8th, we'll call the Wright County Health and Human Services Board to order. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Good afternoon, everyone. So this is like the last day of above 50 degrees, they're saying. So everybody go outside.
Oh, we gotta start wearing our coats now?
Yeah. So everybody review the minutes from the October 11th meeting. We'll entertain a motion for approval or modifications.
Motion to approve as written.
All right, we have
I'll
a
second.
motion by Commissioner Wetter, second by Commissioner Hewsome. Is there any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. The minutes are approved unanimously. Today's agenda, is there any corrections, additions, or modifications to today's agenda?
I would have an omission. So we'd like to remove item 7A2, the right to school presentation. Unfortunately, Jessica Nelson's not available today, and we'll reschedule that for either December or January. Actually, if we wait till January, we might have some more data to share.
Yeah, I was interested in that topic, so I'm glad we're at least
You
bringing
should
it
have the
back.
handout, so
Yeah.
you still have the handout, so yeah, we'll bring it back. Would you rather have it in December to get it?
December or January, either one will be fine, because January, at least we'll be able to look at what the first half of school numbers look like, so.
Okay. Sounds good.
All right. With that modification, I will entertain a motion to approve today's agenda.
So move, Mr. Chair.
Motion by Commissioner Hewsome,
I'll second.
second by Commissioner Ketchmark. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Agenda's approved unanimously. Today's consent agenda, would anyone like to remove anything from today's consent agenda?
Mr. Chair,
Yes.
letter A
Letter A?
for discussion.
All right. And would you like to make a motion?
I'll make a motion to approve the consent agenda with letter A removed for discussion.
We have a motion and a second by Commissioner Hewsome. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Consent agenda is approved with the removal of item A for discussion. Item A, approved letter of need for Sobriety First Treatment Center. Commissioner Ketchmark.
Yep, thank you. Well, I read the letter here to whom it may concern, and about second to the last paragraph, it says Wright County would support this treatment option continuing in our area for the increasing need of services. What does that mean when we say we'll support the treatment option? And I know it's a renewal of a past service, but
So I'm Commissioner Ketchmark. This is Diane Erkins, and she's our supervisor for our mental health and chemical dependency team, and she's the one who actually put the letter together after myself putting her in contact with
Karen.
Karen.
So Karen Remus has been an employee of Sobriety First, and she is currently looking at purchasing the Monticello location and calling it Sobriety First Treatment. So Sobriety First LLC is the overarching company, and she wants to purchase the Monticello location, making it called now Sobriety First Treatment Center. So they'll continue services seamless from when she's a staff currently to when she owns the facility. DHS requires that this letter of need come from the county in order to grant them a license.
So that supporting piece would basically be us saying that, yes, we support this continuing need, that otherwise we would say we don't see a need and we wouldn't support it. So we're just basically affirming that there continues to be a need for this service in our county.
okay. And so when it says increasing need and it talks about DUI, minor consumption, domestic violence, is there any basis that those are going up or staying the same in Wright County?
We have what's called a DANES report, which is a report that we get every year or so.
Annually.
And the data though is back to like 2019, 2020, so we would get that data in 2021. So it's about a year and a half behind. But every consumer that we talk to, there's an increased need for service, there's an increased provider need, appointments are out, so we can definitely see the need for this service continuing in Wright County.
I think it's been shown, I mean, anecdotally here, but across the nation as far as the chemical dependency and alcohol addiction, and numbers were increasing during the pandemic.
I was just wondering in Wright County, because I know those things are tracked multiple different ways. So I was just looking to see, do you have a column that shows that all three are up, or,
Right.
but you're a year and a half behind, so you're not
Right.
sure?
Yeah.
Okay,
We're not feeling that it's going down.
okay.
And Mr. Chair,
Commissioner Houston?
Commissioner Cashmore, I mean, certainly at the Safe Schools meetings too, it's just continue, you know, that's what we keep hearing, so.
Mental health, yeah.
Yeah, from the people
Our
at
caseloads
Central
are
Minnesota
increasing.
Mental Health and
Thank you for
places.
giving us what you have. I'll make a motion to approve that letter A then.
All right, we
I'll
have a
second
motion
that.
by Commissioner Catchmark, second by Commissioner Houston. Any further discussion? You know, I always think it's interesting how the state asks for a letter of need, because, I mean, clearly the private market, because we're not funding it, so clearly the private market's only going to go where there is need.
Right.
Because it would be a poor business model otherwise, so.
Well, we did have one discussion, I think, when, for the day treatment, I think, earlier this year, that kind of came up.
Oh, the one out in Annandale?
Yeah, so I know, sometimes it comes up and sometimes, you know, so we do look at it with discretion each time. In this case, yeah, I don't think we had there was nothing controversial about wanting this to continue because it's already in place, it just is under new ownership.
Most of them are the discussion pieces. I think that one was largely around the fact that it wasn't within in a municipality.
Right.
So in having services outside of municipal services always has a little bit more of a discussion point than that of inside a
Right.
city. So anyways, any other discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. All right, letter of need is approved unanimously. Moving on to the new hires. So we have 3 new hires. Are they all here today?
They are all here.
We're going to grill them.
As I warned them, and I told Paige she was the first, so everyone else is going to follow suit, so stand up, Paige.
So you do know you have to sing now. This is like a big thing. Like, I mean, so we got a hat back here. We'll draw the song out.
Paige Sangren is our new public health nurse. She's here with Kelsey, her new supervisor. She is on the collaborative health services team, and she started actually on October 4th, so she's been with us for a little while.
Okay, well, welcome.
Welcome.
Kind of been baptism by fire. I'm assuming you have been out to clinics and things like that since you've started now? Yeah. Well, we're very happy to have you.
Hit the ball running.
So were you doing public health before this, or?
No, I did pediatric home care.
Okay, very nice.
So do you live in the area or where did you come from?
I'm originally from Dassel and I live in Annandale.
Okay,
Nice. Well, welcome.
yeah, welcome.
Yeah.
See, she
Coming
lives
in.
in the Wright County and she works
Works
for the Wright County. I have to say it since Mark's not here.
Thank you. I was so happy that she told us she was from Annandale. We were like, I was waiting for this one.
They get bonus points, you know.
We do.
Next, and right behind Paige, we have Catherine. Catherine goes by Katie. Yep, you're
Here I am.
Yep, Catherine Lawrence. She's our Office Tech 2 in our Adult Family Financial Services and OT team up on the 3rd floor here. She started on November 1st. Welcome, Katie.
Welcome.
Welcome, Katie.
Is it Kate or Katie? Okay.
Nice.
So same questions for you.
Hey. So yeah, did you grow up here in Wright County, or are you an implant?
No, I currently reside in Becker, Park, Alexandria.
Oh,
Yeah.
well, welcome aboard.
Yeah.
Thank you.
And then next to Katie, we have Allison Backen, and goes by Allie, Stand Up Allie. She's our new child support officer on our child support team, and she also started like Katie on November 1st.
Uh-huh. Very nice. So,
And do you have background in child support?
I do. I have about 10 years, a variety of areas, establishment, state enforcement. So I'm happy to be here. I also reside in the Wright County. So,
You're
Yeah,
not
tell us
currently
where.
right.
Monticello.
the best place to live.
So Derek would be your commissioner,
I know.
and welcome.
thank you.
but I'm Pages.
The best thing about starting November 1st is that November is the shortest month with the most holidays in it. So you guys
Hey.
kind of
So
hit the
way to go, team.
jackpot
Wow.
right off the bat.
So Allison, you must have stole from another county. So, get her to live in the right county, and you stole her from another county, I'm guessing, if she was doing child support. So that's great.
We are happy to have her.
The other counties don't like it when I say that, but, that means our recruitment is doing well.
Yeah, welcome all of you.
All right. Employee of the month.
Actually, we are going to amend this to employees of the month. So if I could please have Ellen and Caitlin come up with me. Oh, yeah. Come on up. We're going to do a twofer today, and this is actually going to take us for our December and our January employee of the month. And actually, they asked me which is which. We actually have you both listed for both, so you guys will have to duke it out as far as the parking spot at the new building. So, so our December 2021 and January 2022 employees of the month are Ellen Chimperly. Yeah, just put the R in the wrong place. And Kaylin Sayan, who has a new last name, so that helps a little bit too. So our December and January employees of the month are Ellen is our adult foster care licensor, and Kaylin is an adult outreach social worker too. Both joined Wright County in 2015. This past summer, HHS was made aware of a facility's very serious concerns related to client safety and lack of services. The physical plant itself is also in violation of numerous fire safety codes. The concerns became an emergency when the owners decided to close their doors in 6 days, leaving 25 people without services or a home. Ellen and Kaylin took immediate action, meeting with individuals to provide information and service planning with them. They worked diligently until each person had a safe plan, which was exactly what was needed in an incredibly short period of time. Their nominator states, you and your team did amazing and fast work to ensure that the needs of these clients are being met. I'm so grateful to have outreach social workers in a situation such as this. It felt very gold star standard to be able to let folks know that our outreach team was on it. A good way to measure the quality of our work is to ask ourselves if this is how we would want our own loved ones treated if they were receiving our services. I would absolutely, in a heartbeat, choose this team to care for my loved ones based on how well you handled this. Another nominator wrote, we are proud of the dream team and so thankful for your resourcefulness and determination to jump in and see this through in such short order. Thank you for the wonderful teamwork. Thank you, Ellen and Kaylin, and congratulations to you both on being our HHS December and January employees of the month. Probably are familiar with the situation that I was referencing, and it was really just, it was very stressful for us to think that we're going to have potentially 20 to 25 homeless people here in our county, people with very high needs, and the fact that this, they went out there, you guys kind of planted yourself out at that facility and met with everybody, and of course, I think one person had lived there for almost 20 years, and they just heard they were being ousted in 6 days, so of course, their stress and everything else was running very high too, so these folks really stepped in and did an outstanding job in getting everybody placed. Most, I think, locally, and a couple in some other counties, I believe.
Well deserved, you two. 'Cause that was a pretty traumatic time.
With finding placement in 6
Yeah.
days' time, that's
It's-
pretty.
Yeah,
If you would have asked us, could we do it, I'd say no.
No.
And then they turn around and do it, so I think that's
Yep.
really, again, the hallmark example of great service.
Somebody has a robust Rolodex.
yeah.
Thank you.
So moving on to the regular agenda, we have item A1, the Information Public Health Foundation capacities. So Sarah?
Does it say capacities?
Oh,
Capability.
capabilities, I'm sorry.
I can't open the board agenda because I haven't restarted.
I'm
my
going to put
computer.
an
That's
S
my
instead of
fault.
a B.
Yeah.
So in order to display, do I have to join the teams? Is that what? Okay. I can do that. I was trying to avoid it, but I can. So I'm just pulling up the same handout that was attached for you, or I thought I'd share it so I could show you what we're. Nice. and I'm the guest, right?
Oh, yeah.
Perfect, thank you.
Yep.
There we go. So, when Jamie and I discussed what we wanted to let you know about what was happening with some public health funding, we thought it would be best to start from the beginning. And what you have is a document that's pulled from the Minnesota Department of Health website. We started this process of updating the governmental public health infrastructure in Minnesota prior to the pandemic. And landed on Minnesota's version of what would be the foundational areas and capabilities of local public health. We're going to focus specifically on the capabilities today because they're cross-cutting. They should be part of all of those areas above, but those are also foundational, I would say, if you want to think of them as program areas. We have to have infectious disease prevention and control. That includes immunizations, but it also includes things like refugee health, TB, other disease prevention and tracking that we do. We have to have an environmental health component. I think it would be important for me to say right now that we spent a good portion of our local public health grant funds in supporting that through the Planning and Zoning Department. So we're anticipating how that will develop because that was our one of our main methods for meeting this environmental health foundational area.
So I think, in that respect, I did have a discussion with Lee, but probably would want to continue, depending on the candidate that's selected and how that would be met, how this environmental health services would potentially be met under a new candidate in the planning and zoning area.
We have to work on prevention and population health improvement, and a lot of that is chronic disease, but also can be looking at children and families' health. And so we have both and senior health, so we have our collaborative health services division, as well as our health promotion and our healthy children and families team all work in that area. And then access to health services, and that's really for special populations, people who either have access issues due to financial needs, they may have functional or other access issues. And considering we're going to be talking about the dental clinic tomorrow, that's again one way that we're able to meet that through our community health needs assessment. But foundational to all of these are these activities that kind of happen in each of those areas. So the first is assessment and planning. We mentioned the community health needs assessment. Many of you know the survey is in the field right now to update that assessment for the coming year with our hospital and community action partners. We have to work on communications. We have to work on community partnerships, data and epidemiology, health equity, leadership, organizational management, policy development, and preparedness and response. So the reason I went over this, and there's a description of all of these areas, which I will go back to 4 of them in a minute, is that in the 2021 legislative session, we, public health at the state level was awarded or assigned 2 different pots of money. We got a $15 million 2-year increase, and it's at the base to our local public health grant. And we already hired a person. We made that change in funding sources for one of our public health nurses, which you were so gracious to fund, and we filled very quickly to work on some COVID and disease prevention control activities, so right into those foundational program areas. And then we were also granted $15 million over the biennium, and it's into the base, but it's to work on public health infrastructure. So members from SHAC's executive committee, so I know we have a commissioner from Stearns County and a commissioner from Olmsted County, and there's a few other commissioners there, as well as myself and a couple other local public health directors. I know Pine's at the table, Cook County's at the table, Polk, different counties from across the state are working on how to implement that $15 million into some type of grant fund. And I wanted to give an update to that process. So this is the infrastructure fund statutory language, and I did not give this to Amy, I apologize, so I will make sure that she has it for the minutes. But we're working through how we can distribute these funds before the time is up to make sure that our job is to improve the public health services to underserved populations, pilot new organizational models for providing public health services, including multi-jurisdictional partnerships, or otherwise improve the state's public health system so that it satisfies national standards, including standards for health equity. So, and this is we're working through subdivision 2, which is the process by which these funds will be distributed. And we anticipate to be finished with that process in December, at which time Jamie and I and my supervisors and I will go through a process of determining how we're going to access these funds. I don't know if it'll be competitive or if it'll be each county gets a portion, but as a rather large county, we should see hopefully a decent amount of funding from that. We received $87,000, I think, from the local public health grant increase.
There's 15 million.
Of the 15 million. So we should anticipate, I don't know if it'll be similar or how it will work. So
What are the use restrictions on that?
well, that's what we're working through, right?
Wait, on the previous one that you got, the one, the 87,000?
Oh, hardly any. That's
Oh,
that's
nice.
Yeah, that one was very nice.
Those are rare.
Yeah, we have to meet the 6 areas of public health responsibility, but
But
they're
that's
very
pretty broad, yeah.
Yeah, so we stuck with the foundational capabilities just because, or the foundational program areas. Like I said, we're adding disease prevention control. Just with a county, we have one person in that role prior to that with a county of 140,000 people. That's just kind of difficult. And in fact, considering we're still dealing with a pandemic, and our primary disease prevention and control nurse is dealing with 4 TB cases right now. We've never had 4 at one time. So it's just, with a growing county, we're gonna need more capacity in that area. So we need to come back and figure out how we're gonna spend those dollars. So you may hear us talking about that in the future, and I didn't want it to be the first time that you heard about these foundational areas. And let me go to the internet. So the 4 areas, we've narrowed it down to 4 areas that they will be able to apply or document your funding if it's everybody gets an allocation. The first would be to communications. That came out across the pandemic, the idea that we need to be communicating often, that we need to be communicating in a way that our public understands, and that there needs to be some robust capacity in order to coordinate communications across jurisdiction with the state. I think everybody can agree that the types of information and the variety of information out there from a public health perspective is pretty daunting when you think about the pandemic. And people are now have a different expectation of our department for how much we communicate, how often, and how detailed it is. I think that's just true of any public health department. The other area would be on around data and epidemiology, so specifically about our ability to track data and provide it as fast and as real time as possible. And one of those things we've pushed back on the state is the interoperability. So a lot of our data we collect, but it goes into a state system, and yet we struggle to pull that information out in a timely fashion, or we have to wait till MDH reports it back to us, which sometimes can take a long time. So we would like to see this, because again, there's new expectations. People want to know the information right now, and they want to be able to see it, and they want it to look nice. And sometimes they want a level of granularity that we're not used to. It's not okay, I think, right now, to just tell county level data. People want to know zip code, or they want to know their city. So there's a lot of information that people want to get. There's also the expectation to work on health equity. I don't think there's a definition in here. And on community partnerships. And I think right now we're discussing, because health equity, if you saw in the charge language of the funding, actually is set out by itself, whether or not health equity is reflected in both the data, communications, and community partnership piece, or if it's a standalone item. But for community partnerships, that's the ability to connect and align community resources and partners to advance, so that we're basically, if we're aligned, the sum is greater than the parts, right? So we do something, I mean, I think a good example is our partnership with our hospitals and Wright County Community Action, our community health needs assessment. We're all aligned, and that makes the effort that we put in, I think, just that more magnified and has a bigger impact on our community. But I also know that we developed a lot of partnerships with our employers and other organizations over the pandemic that we would like to continue, but it takes time and resources to maintain those partnerships and reach out to folks. So I don't know what the grant proposal or what it's going to look like for funding or what the expectations are, but this is where it's been narrowed down to.
It's actually been very quiet too, I would say. We haven't heard much at all,
No.
other than the initial announcement of the 15 million.
Yes, and both these $15 million pots are in the base, so they'll get rolled over every year, they're renewed. But in 2023, which is not that long considering we haven't even received the grant on to, we wouldn't even start activity until 2022 for this funding. MDH has to report back to the legislature if they would like to change those allocations. So they could move some out of this infrastructure fund into the local public health grant, for instance, because that is such a flexible pot of money.
Did you say we're going to have to apply for this?
We don't know
money?
yet.
Oh.
There's, I think, differing opinions on how that would work. And then, of course, we can partner with other counties, or other counties can partner with us. That's an opportunity, multi-jurisdictional. I think that was specifically, in my conversations with the state, I think that was specifically directed at smaller counties, smaller than Wright. But there are some ideas about a county maybe holding like a center of excellence is another idea, where a county might hold the epidemiology capacity for a region or even for the whole state as one of their functions. And again, that's different ways of thinking about it. And does that give us better access to the information or more impact on how the information is released or how it supports local public health than having that capacity at the state? So these are all conversations we started pre-COVID, so I'm very excited to talk about them again. But I can tell you for sure that what consistently came out of after action reports across the state and even within the state as a whole was the communications and the data piece. My update.
A lot of that data would be really interesting, you know, like from our standpoint, and I don't know that epidemiology would really qualify because cancer is not really that type of a illness that would be.
Oh, cancer epi is absolutely.
Is it?
Yeah.
Because the standpoint is like, okay, we're a high radon zone. And in trying to really collect data as to people from our area that have contracted radon.
Usually it's a type of lung cancer.
Yeah,
Yeah.
it's a very more specific type of lung cancer you get with radon, but there's not a lot of information where you can track like regionally as to, okay, like Sherburne, Wright, Stearns area, which is a high radon zone, how many radon stimulated cancers were diagnosed in the last year, you know?
Yeah. No, that's absolutely one of those things that you can do with an epidemiologist. They don't just look at infectious disease. Chronic disease is another piece where you're looking at those root causes and can look for, is it by chance? You know, sometimes people say, oh, I think it's a cluster because I've heard of X number of people who had pancreatic cancer. What if it's all related? And they're able to kind of delve into that a little bit more.
Because it'd be just interesting to see the people that were like born and raised here, that lived there their entire life, that actually contracted it versus people that are just implanted into here, that could be random, you know?
Yep, and then they can research the studies on how much exposure should you have before, or would you expect to have before you see cancer develop, right? So I think those are great questions for an epidemiologist.
They could partner up with the GIS folks.
Yes, and then of course people, like, I think that's both an epi piece, because you don't know much unless you know where, but also that communication, because people like to see the data now displayed visually. That's,
Yeah, we already checked all the boxes. We're partnering with Sherburne and Stearns County. We are doing data epidemiology, and we're going to communicate information. Wow, we checked.
unfortunately, they're not going to give us the money to supplant existing structures.
That is probably the one, that's probably the one piece,
Yeah.
is like the money doesn't supplant. It's nice that it's in the base, but it doesn't supplant.
Yeah, it doesn't supplant.
Thank you, Sarah.
Thank you.
Yeah,
Sarah,
thanks,
I've
Sarah.
got a question
yes.
yet. So does an epidemiologist look into like if there's like some, maybe it's in the family, a certain disease, or,
Sure, yep.
I mean, they look into the gene pools besides what might be like in the water or the.
Right, so different, like, for instance, if we live in a community where there's a lot of ancestors or people grew up in this community, but they immigrated from an area where there might have been a prevalence. So there are certain diseases where there is like a genetic predisposition. Cystic fibrosis is one that's more predominant in the Caucasian community. If you're predominantly Caucasian county, are you seeing, a lot of cases of that because it's genetic between families, or is it also because you just have a very prominent
And
portion
some-
of your population that's
And some
Caucasian?
cancers, some diabetes, there's lots of
Yes,
things like that.
and we're learning more and more, I think, every day of what might be a genetic versus an environmental, or sometimes a combination of both.
Okay.
Thank you, Sarah.
Yeah, thank you.
Very good. All right, now we are down to the Adult Protection and Child Support Performance Report, which I'm guessing it's going to be just glowing. We're going to be over 100% again, right?
We are actually over 100% in one area.
This is one of those ones, Mike's going to ask the question, how can you be over 100%? Because all of us have asked that question because
Your numerator and denominator, that's all I can say. I'm actually just going to start on page 4. You should have this report in your handouts. The rest of certainly feel free to read it out in its entirety, but I'm just going to focus on the results. So the first one I wanted to share with you is the outcome is adults and children are safe and secure, and the actual measure is % of vulnerable adults reported as maltreated with initial disposition for response made in 5 working days. This is actually just a baseline, so the first time we'll be measured on this is in 2023. So this is just setting us up, but you can see what it's looking like right now. We had 380 people that apparently had an initial disposition in the last year. So that'll be revisited in 2023. The next item on page 7 is % of vulnerable adults who experience maltreatment who do not experience repeat maltreatment in the next type of the same type within 6 months. You can see that Wright County improved dramatically in this area. I do have, if Rochelle, oh good, your camera's on, Rochelle. I thought maybe the board would like to hear from Rochelle what she would maybe attribute this to, because if you look, we were at 100%. Back in 2017, we dropped down to 92% and then down to 90%. The threshold in this area is 80%, so we're still above the threshold. Then last year, we made some significant inroads up to 97.22%, and currently for 2021, we're at 100%. And we had 36 individuals that were part of this measure. So Rochelle, can you just maybe let the commissioners know what you would attribute this to?
Good afternoon, commissioners. Thank you for letting me speak.
Hope you're kind of quiet.
Can you hear me?
Oh, yes.
Yeah, okay.
Yep.
So I would say that since we reorganized a couple of years ago, and now adult protection is on my team along with initial mid-choice assessments, one of the things we frequently do is when we get a report of suspected maltreatment on a vulnerable adult, we don't necessarily feel it meets the statutory criteria to have adult protection get involved. We make a referral for a mid-choices assessment and then offer that assessment to the identified vulnerable adult. And so we're putting in services and supports in a voluntary basis for many people that maybe otherwise wouldn't have access to those services and supports. And I think that's probably the biggest reason why that duplicate maltreatment is such a low number for us. And then the other piece that is we're collaborating with the identified case managers. Often we'll get a vulnerable adult report. If there's a case manager involved, we make sure to, talk to the case manager, talk to them about maybe they need services or supports, maybe they need to do some additional safety planning. So I would say that was what's attributing to that number.
Thank you, Rochelle.
Yep.
Yeah, and just to point out, it looks like we're above the statewide average and our regional counterpoints. Now, shifting gears from vulnerable adults to child support, and I guess our new child support officer can be happy to hear this particular report. So the percent of open child support cases with paternity established, Wright County is outperforming other counties, and this is where we have that above 100% designation. So we're at 107%, which is above both the regional and the statewide levels. Just very briefly, what I could say about that 107% is that they use the paternities established, I think, in the given year, and the denominator is the number of paternities in the prior years. So they're kind of offsetting 2 years of data, which then results in potentially a higher than 100% number, which seems weird, but we like to say we're at 107%, so that's great. The next one on page 11 is percent of open child support cases with an order established. So this would be different than a paternity order. Paternity order is like potentially you have unmarried parents, or who knows what the situation is, and in the event there's no legal parental responsibility, primarily on the father's part for the child, and under orders for establishment, these would be potentially partners, or there could be a recognition of parentage signed for the kids, or there could be a temporary dissolution of marriage, or it could be a divorce that happened and now they're just setting support. In this situation, so it's a little bit easier, I guess, and less legal involvement than the paternity actions. Again, we're outperforming the statewide and the region. We're at 92.6%. And you can see the number here is 3,390, so almost 3,400 cases that were looked at. And then the next one is on page 14 of your handout. It's percent of current child support paid. This is always one that we pay close attention to. It's dipped a little bit. We're still above the threshold and above, again, the other region, or the rest of our region in the state. We're currently at 79.21%. We do like to be at that 80% because we do maximize the reimbursements from the state if we can be at that 80%, which we have in the last few years. So I'm not too worried about this 1 year dip, hoping that next year we'll see it back up over 80%. And then I just thought, because Sarah was just talking about, and I don't know if it's really too related, but she was talking about health equity. This is a new report that I saw on page 15 that I don't think it was provided in previous years. Racial data for percent of current child support paid. It just says the racial and ethnic data included in this report is for information and planning purposes, so we're not actually being measured on it. But I think I'm relatively pleased to see that there's not a huge disparity between the current support that we're collecting between Black, Hispanic, other unknown, and white payers. So I think our child support group is doing a great job collecting support at fairly high rates across the board. So I guess we're equal opportunity people for collecting child support. So very proud of our vulnerable adult investigators and our MnChoice team, along with our child support team. And I'm very happy to report that we have no PIPs required based on this annual report.
Good.
Questions?
Great.
Thank you.
All right, moving right along here. Now we get to the third quarter financial report.
Good afternoon, Commissioners. Amy nicely linked the dashboards into the agenda, so each quarter you'll be able to preview those even before I arrive at the meeting. For today's topics, I'd like to just cover the summary page, do a little bit deeper dive into some of the public health grants, and then take a look at some of the dashboards that we've modified in the last couple of months, and depending on time, go through the rest of the dashboards. So for the month of September, we are at 64% for revenues and 68% for expenditures. We're at 75% of the year, so we're in good position that our expenditures are still under 75%. And our revenues, they're slightly down from where we were at the same time last year, but a lot of our public health grants are billed on a quarterly basis, so some of these larger grants, you know, we'll see more revenue received now in October for what we've billed in September. There's just that lag time. So overall, I think we're doing just fine. You'll see throughout the report that I've done a lot more work on removing the acronyms from the various chart of account descriptions. There's still a lot left to go. And we have already identified that there are a number of places that we need to do budget revisions, including some grants that we received that a budget revision wasn't completed with the original staff request. So you'll see those in the next month. So if we go then to where the main public health detail reports start on page 23, the $87,000 that Sarah was talking about goes into line 11, 450, 53, 53, state grant public health subsidy. You see we've received the 269, which is our original base grant, and then as we bill for that additional position, we'll recover the additional amount of the funding. That one is on a state fiscal.
Yes, so we received the budget passed.
Sorry, that one. Okay. And the public health subsidy is using all of the expenses in general public health. It's the one grant area that we don't have it set up specifically to track staff time. So then if you go to page 25, the first...
Maybe you're going to point out the immunizations at 1,193% of budget.
Oh, shoot, I had it circled on a page before. Jamie's right. Yeah, so immunizations, which is the majority is
That's
going
more
to be
than
that
107%.
over admin fee. It's $245. That does include any flu vaccines that we've done. We also do the admin fee on that, but that, of course, is a fairly small amount compared to what we're doing with COVID. And that, we started doing boosters again, so we'll see additional revenue continue to come in for that particular area. Okay, so then on page 25, the first grant listed is, and I'm going to read the third set of numbers, which is 440. That's a federal grant we received for influenza vaccine administration, and that one has been extended through June of 2022. So the fact that we've only received $16,000 out of a budget of $34,000. It's fine because we'll continue to do the work. We've got another year yet to do that. The next one below that is 441. So this is the COVID vaccine implementation grant. This one ran from February through June of this year. And the expenditures here are more than the grant award, but during the time period of those expenditures, we did not have another grant that would cover COVID expenses besides general public health, and we did want to keep them separate because we didn't know if there would be anything coming down the line that we could use those expenditures for. So an example of that is then on page 27, Program 471, Maternal Child Health Grant. They had given us a waiver to cover COVID expenditures. When we got through the end of the grant, which was September, we were able to look back and use some of those expenditures that I just talked about to meet this grant, so we will fully expend that grant as well. Then skipping to page 30, Program 475 is our drug-free community grant. We did finally get access to the payment management system, and we're able to submit our entire grant request for the grant period. That revenue will be receipted in October, so it will show up on your next report. And this is one area for sure that a budget revision needs to be done, because you'll see there's no budget in there. Then we go down to page 31. We have 484, which is another COVID grant. This is also for expenditures in March of 2021. We're checking on where the revenue went because this one has been fully expended and it was $34,000 or $35,000 and the revenue's not showing up where we expected, so. Following that is 485, another COVID vaccine implementation grant. This is our large $746,000. I believe it was extended now to 2023, correct?
We will be getting, we haven't received the contract update or amended, but we'll be doubling the funds and extending the date.
This particular one is one that we do bill quarterly, and we subtract out any revenue that we've received for vaccine administration. So we're not double dipping and charging the state grant for time that we used to also then bill the admin fees.
Okay, so the 134 is the admin fees that we've gotten so far, and then we'll be getting the other 30,000 is going to be paid out of that 400 and some thousand grant that.
Okay.
Which is about 400,000.
The 134,000
Being paid
was
to the-
for expenditures from April through June. We billed it in July and we subtracted out any administration fee we received at that time. So then what our expenses for the second quarter, which would be including that, part of that would be the 395. We will bill that now in October. Well, we billed it in October. We would have subtracted out what we collected for administration fees and we'll receive that revenue and you'll see that one on your next report.
Okay.
It's always a quarter behind too.
So at some point, if we stop receiving insurance revenue but have to continue providing vaccines, we have more of our funds.
Well, at least it looks like we're trending that we'll have the rate that we're spending it versus the money that's coming in for administration. We will have I mean, odds are that the expenses
That'll
are
be
probably
pretty
going to go
good.
down from here because I think we're at the peak of. I don't know. I guess it all depends on how many.
Yeah.
Don't jinx it, but yes, I'm thinking we're gonna come out okay on this
Oh,
one.
okay, excuse me.
Yes.
I have to do.
And that's from a lot of work on fiscal.
Christine, take over.
Yep.
Any other questions on that page? Otherwise, the last one that I'll cover is on page 32. That is 489. 489 was used for our CARES funding in last year, and then it was used for January 1 through March 31 for another time period when, again, we didn't have any other grant sources to track the COVID expenses. So that's the big update on the public health grants. Any questions on this document? Otherwise, I'll switch to the dashboards then. Okay. So the dashboards, aside being in the agenda, they are available at any time going to the Health and Human Service financial report on the left-hand side and then under the dashboard. We're looking now at the quarterly ones. So the first one we're going to take a look at is the income maintenance one. So it's set up different now. At the very top is going to be our year-to-date cumulative. And you can see it's got the budget in there. So right now we're here, quarter 3, we're just a hair under the targeted budget. You can see over here that in quarter 1 it had gone down from the prior quarter, but then the next 2 quarters, 2 and 3, it's gone back up compared to the quarter before. Then we have the total quarterly revenue in a different format that just shows the target for each quarter in this year. So you can kind of see quarter 1 we were pretty close to the target. Quarters 2 and 3 we were a little bit low. What we also added is what our expenditures are.
So we only get reimbursed for what we submit for expenditures. So you'll see in quarter 4, we submitted 1.6 million. We received that revenue in quarter 1, which is where quarter 1 was where we were really close to the target. But then our expenditures were down for quarter 1, and again, they're down for quarter 2. So by looking at this, you can understand why we're not, even though we're not hitting our target, we're in alignment because our expenditures are also down. And then the last new thing that we added was a comparison of the rate. We need to do some tweaking on this calculation, but it's going to be close enough for you now. This is what we receive, our total federal expenditures compared to what we receive for revenue. We want to see this over 50%. Due to the timing, it's not looking quite at the right data, so that's why this is 59% when it's usually hovering just over that 53% mark. We'll get that fixed by the next report. And then below is all of the detailed lines that feed into the time study IMRMS. So that's income maintenance. And we've done the same thing with social services time study. Year to date, you could see quarter 3, they're just a little bit below that forecasted amount that we would be targeting for. Same situation though, it dropped quarter 1, it's gone back up quarters 2 and 3. See, this is the target that we set, that it's been lower than, significantly lower than our target. Our expenditures have remained reasonably stable. So when you look at the rate of return, this is where we're seeing that drop, where, you know, we were much closer to 19 and 20% in the years before, and it's just continued to kind of drop, and that's what we've been. So where are we missing out on the revenue when the expenses are high?
We haven't been able to figure that out yet because the state released new instructions at the same time we sent everybody home for COVID. So it's hard to tell whether, is it significant changes in the instructions, so now where staff were coding to a billable source, now they're not, or is it just that the activity changed when they're working from home? And so we've been working at that, but it's really not an easy thing to uncover. Our preliminary, you know, Diane in particular has done a substantial amount of comparison between the SSIS time and the random moment time, because we get the report and it's correct. There's just some questions some things that have changed, but they shouldn't have made a significant. Questions on that one?
I tell you, I know, it's the same old day. It's that whole random moment, the whole.
It's like the shell game, you know, it's like, where is it?
Hopefully it.
What are you doing right now? We may or may not pay you.
Right.
Okay, so then next we have targeted case management revenue, and you can see that's hovering pretty close to an average at our anticipated budget, which is great news. You see I've got these in opposite order. This is the year-to-date with the budget, the cumulative year-to-date. So targeted case management is looking good. We have been digging into that one as well because it plays into some of our other categories like Title IV-E revenue as well. Have waivers. Here's your quarterly look at it. It did drop down in quarter 3, not a lot, but it's quarter 2 is up considerably compared to the prior year. We look at the year to date. This one is right on track for the target for the year. That one we expect to do fine. Going to skip the public health one because we talked about that one pretty in depth. Out-of-home placement, I haven't finished this one, so it doesn't have a nice total graph to date. This is kind of where it's at. This is one where it's good if it's going down, so we like to see the red numbers. This is an expense, not a revenue. That's the majority of what I have to report. Any specific questions I can answer?
So Christine, as far as, because the out-of-home placement is kind of targeted for the opioid settlement dollars, and if we're seeing a decrease, how do we don't really know how that's going to play into the opioid settlement for what they can reimburse out of that?
Well, when we're seeing a decrease, where it's holding is good. We're not seeing the increase years before. So without knowing the details of the settlement, it's hard to predict, but it's not like we're getting to a zero number.
I mean, I'd rather not have a bunch of expenses that it's going to offset, because it means kids aren't in out-of-home placement.
Yeah.
Any other questions?
Lots to keep track of, for sure.
Yeah.
Wow,
Thanks, Christine.
yeah, thank you.
I don't see how you can.
It's a crapshoot.
That's what, and that's what, you know, it's like playing darts, you know, is it gonna hit there or there?
I mean, we work really hard to come up with a very legitimate budget at all times, but yes, it's hard to know the direction, especially, and I've said it 100 times, when you're doing it a year and a half in advance, it feels like, to when, you know, all these changes happen.
Yeah,
so.
because you don't know whether there's a.
I think we actually do
grant
pretty
somewhere.
well, but yeah, there are just some unknowables, you know, we keep trying to nail it down, but as soon as you nail something down, it kind of shifts in a different direction.
So where's your crystal ball, Ken?
On order.
Oh, okay. Your money tree.
I just had a few directors, well, maybe more than a few. I have some directors' comments. Actually, I have some handouts too. First, I wanted just to let you know, and I mentioned at leadership last week, is that we, as usual, we did our employee engagement survey. It was not without some trepidation sending it out, because I know, you know, staff have really had a difficult time between both going home and coming back to work over the time, so we weren't sure how it was going to look. I had a feeling it was not going to necessarily improve over last year's, because we had kind of hit a high for our overall employee satisfaction at over 4% out of a 5, over 4 points out of a 5-point rating. It did fall about a half a point, so we're sitting at about 3.5 for overall employee engagement for overall job satisfaction. So I don't have this whole, we'll be bringing this to you probably in December, the entire employee satisfaction survey. But just to kind of let you know, that's kind of the direction that it's going right now. A lot of the comments that were made were kind of around the working situation and flexibility and things like that, that I don't think is a surprise to anybody. So just a heads up for that. I do have a few handouts. This one, I don't know if you've seen it yet or not. Sarah mentioned the Community Dental Center. This is
I
kind
have a few
of
copies, actually.
oh, did you get copies in your?
I,
Okay.
well,
Give it to someone.
she spoke, yeah, Karen spoke at
Oh, I
Rotary,
see.
so, yeah, so it was good.
Yep, there you go. So anyhow, this is kind of, they're getting the word out, and we were asked to share this with other counties as far as the openings coming soon, and you can see on the reverse side, they have kind of pictures of all the different clinics and things like that. So, and I believe, you've probably heard, I was on the fundraising meeting last week. I was on my way home from the cities and just kind of called into it while I was driving, and they've met what they needed to meet the $800,000 to pull down the $1.4 million state bonding funds. So that was fantastic. So that is in the works. They're still trying to, I think, raise about $200,000 on some other starting expenses. Some good news. I'm going to intersperse like not so good and good stuff in between here. Some good news. We had, as you know, we changed our phone system, so HHS is kind of on our own out here in our new phone system. We went to FirstNet. While our annual or our monthly bills are about the same as they were when we were with the same phone system that the rest of the county is on, we did get a $38,500 cell phone trade-in credit. So that is funding that is to the good for the county. So, and that's all going very well as far as the move to FirstNet. I think I only have one of these, so I hope you have it in your. Did they have them? Oh, Diane has them. Okay, thank you, Diane. Diane will tell you a little bit about the upcoming North Star Regional Riverwood Campus Open House on November 17th.
So this is one of the things that comes out of the letters of need. Thank you. So North Star Regional is one of our chemical dependency providers that came into our community a while back, and they have revamped the entire Riverwood campus. So just north of the outlet mall there, that it was a convention center and hotel and housed some individuals for a period of time, and now it is going to be an inpatient treatment center as well as a outpatient treatment with lodging location. So they have invited you all
Timothy's?
yeah,
Yes.
to the open house. So hopefully you can make it to see that.
Diane? Just kind of a update on our CAMI group. It's our Community Adult Mental Health Initiative. So they are granting an additional, we're in this with the three other Benton, Stearns, Wright, and Sherburne counties. And CAMI, this initiative, is granting Wright County. They had, I think, $200,000 to kind of split up between the four counties to work with mental health and inmate population. And so Wright County is going to be getting an additional $61,000 to serve our incarcerated individuals dealing with mental health issues. I just want to give you a heads up. I'm kind of, right now we have a part-time employee. As you know, Jill Nettestead works in our adult mental health area, and she works part-time in the jail. It would be great just to say, okay, Jill, we're going to make you full-time in the jail and take care of, use this other $61,000 just to pay her salary. But then, of course, Diane would not be happy with that because she's got a bunch of adult mental health cases that she needs a case manager for. So I'm just wondering if maybe there would be some ability down the road to talk with the board, maybe in a personnel committee meeting, about maybe using the $61,000. And I didn't mention this to Jill or Diane, maybe looking at some of the ARP money to put it together for a position. We have $61,000. It would be the difference between that and, and for a full-time employee. Otherwise, I guess we could look at an additional. I think the only service we can really provide is staff time. I don't know if there'd be any other service that would be. Okay. Oh, Diane's got handouts. So anyhow, just wondering about the board's willingness to look at some ways to use this funding to advantage in our county and meeting the needs of our prison population. Questions about that? We don't have, Diane, could I have them too, please? Those are on my notes. Thank you. Okay.
Mr. Chair,
Yep.
just a comment, I think when we hear ARP and staff requests, the two don't really go together, do they?
Not really, because this money, it's finite money, so eventually it's going to come out of general fund.
Yeah.
The hardest thing I have about jail programming, especially in light of the way courts are going nowadays, the sentences are getting shorter and shorter and shorter. That what used to be in for 60 days is now in for 30 days, and what was in there for 30 days is lucky if they're there for a weekend. And even one's cases that used to get up to a year are lucky to get 2 months now or 3 months. So it's really hard to do any kind of programming. Really, from a jail perspective, they've shortened all the links so much that it's almost got to be more on a state level from a prison side of it. That's the hardest thing.
Well, I know I've heard from Pat, and they really like Jill's services that she provides there, now, and that it's shown, as we've seen, a lot of less recidivism, which would then maybe mean less of any kind of jail sentence down the road. But it's a hard nut to crack.
And Mr. Chair, it might swing back when they actually let them have court in person, and some of they're so backed up, and it's in flux right now, in my opinion. So hopefully things will get,
Hopefully, but the hardest thing right
Yeah.
now is like because the correction side is so constrained right now that's another thing that you're coming out of post-COVID. They shortened sentences now, but now the jails population or the staffing to the jail population is so constrained that that's also playing into getting shorter sentencing.
yeah, it's,
A DWI will cost you more than getting a felony drug offense right now. You'll pay more money and serve more time in jail on a DWI than you will on a felony drug charge.
And I think this, we could also look at commitments and things like that. With this funding too, so some of this is more peripheral to just the in-house jail. So I think that we could look at ways that we could use this funding for, again, reducing the jail population in general and meeting some of those mental health needs. This next one is a little bit, I wrote down my notes, it's a little bit confusing. So for years, I think probably maybe pushing 20 years, this is on the Wright County Family Services Collaborative. So we've been working with this collaborative for many, many years. We're the fiscal host. And just more recently, we've been working with Tim Dahl and administration as at some point along the way, Tim discerned that the collaborative has no legal status as an entity, and as such can't get insurance provided for it. So because we serve as a fiscal host, and there's no joint powers agreement that we can locate, so it's kind of I would say it's kind of a mess right now. So we've met with the collaborative board, and it looks like they're going to turn what their desire now, and is understanding that in the absence of a joint powers agreement and without being a legally formed entity, that they cannot get insurance, and we can't run the risk of being the host when they don't have insurance. And so the collaborative is looking at turning the reins basically over to HHS to run, so it could be covered by our insurance through MCIT. So we're kind of back to the drawing board with this as far as how that would work out staffing wise. They currently have 2 collaborative employees that work not a lot of hours a week, fairly minimal hours a week, to see how that would work. But just for your information, so the collaborative serves schools, serves HHS, public health, court services, and other child-geared organizations. So we'll probably will need to bring this discussion back to the board at a future agenda and/or the personnel committee to figure out. In any event, we're compensated for our time that we're spending being the fiscal host, but Tim did unearth kind of these irregularities, so we're in the process of looking to see how we can make this collaborative be whole again. I believe it used to be funded to a higher degree, maybe close to $500,000. Now I think they're closer to like $300,000 or something that's funding this group. Excuse me. I've got a couple of, I'll just hand these out, some holiday projects that are going on. And the other issue is just an awareness for the board. We had a situation develop about a couple of weeks ago with one of our staff, was on a call with a juvenile client and was assaulted. She, a law enforcement was brought in. Charges were brought against the juvenile. It was a very pretty horrific situation. The individual has taken some time off. I think, has worked administration. HR has been very good with working with her, but just an awareness for the board that this situation occurred. And then we are working on some safety strategies. We are working with the facility that this happened at. It was kind of just, I would say that Bermuda Triangle of things coming all at the same time that when this occurred.
So this was like a residential care facility?
She was at Village Ranch.
good.
She was at Village Ranch. But she was able to isolate herself from her attacker in a room and get some help. But it was pretty horrible, and she's been through a lot. So we're working with our staff, and we're just looking for support from the board to continue to work with our staff on safety issues, both going out to homes and just an awareness that these kinds of things can happen almost anywhere. Construction was happening outside. There was just all these different things going on that just occurred, though. So
which is
at
more
no
of
fault of the
huge
staff.
concern in today's world, just because the mentally ill, I will use the word, right now are there's a lot more agitation in there, and
lot of
we're seeing
anger.
a lot more violent outbreaks from that population, so it makes it just that much.
Right, and, and I think, and it's a different, when you're a social worker and you're trying to create a rapport and trying to create a relationship, it's maybe a different situation than when you're there as law enforcement or you're there as court services. So I think while with the safety concerns all around, the perspective is just sometimes different depending on what hat you're wearing. So again, I don't know if Michelle would like to say anything else, but I think we've been trying to work with this individual and, she's returned to work now, kind of working through this, so.
And we do have her permission. Really, her ask was that we just be very mindful that this could happen any day at any time. We have 80 social workers, and their primary work is out in the field with clients, and actually in less safe situations than what this worker was in private homes where there aren't staff around. You're just meeting with that client.
We are going to be working with law enforcement. We've been talking about using the house in Annandale to do some kind of teams training with, is his name Brian?
Mm-hmm.
Brian Johnson?
Yep.
To do, and you'd hate to have something like this happen and be the catalyst for the training, but I think in any event, now that we're kind of re-entering the world of meeting with people again after almost a year and a half of not doing that as much, it's a good time to be revisiting those kinds of practices.
Wow.
We had a virtual safety last October, and it's been our plan to have annual safety training. But virtual doesn't cut it. for this kind of- So we're looking forward to the in-person.
Question then, in that circumstance, can you fight back, or or is the suggestion to run away, get away from it?
To remove yourself from the harm.
Okay,
Yep.
because
I don't think, if you saw this individual, I don't know if I would want to put her up against.
like a police situation,
Right.
where, you know what I'm getting
I think if
at.
everything else, and I don't want to speak to a safety issue, but I mean, if every other avenue is already, you've gone through, you can't make it out, then obviously fighting back would be the last option. but-
Okay, I just was curious what you tell them to do.
Mr. Chair?
Yes.
I suspect that this will come up at the next safety committee meeting, which I think is going to be in January, maybe it got delayed. But I'd like to hear more details, and it sounds like she's willing, whatever is allowed. Because when you sit at these safety committee meetings and the host says, oh, we had an employee injured, and it skims over it, and is there any feedback? Well, sorry, we don't have enough information. But I happen to know Village Ranch from one end to the other from working there many years, and I would really like to weigh in on suggestions. I know the management and the staff, but without enough details, we can't weigh in as much.
So, and I don't think Health and Human Services is at the table for the safety committees. I think, is this what kind of Mike McMillan was heading up, or is this?
No, Tim Dahl. So
Tim Dahl.
every employee incident where there's an injury or accident,
Well, yeah, they're well aware of
About
it,
it.
and we absolutely can provide that. And just so you know, Michelle and Tim were planning a visit to Village Ranch to kind of take in the surroundings, and Tim to make recommendations based on what they
Good
find.
idea.
So I think we're being very proactive in it, but it just occurred.
To me, it's kind of funny because you're taking the facility into question, and it's not the facility, it's the people, and the people can be anywhere. So really, you really don't want to even spend too much time dwelling on the facility, because that's the
I think maybe
that's
they're
the changing
talking
caveat
about,
is how we're going to deal with individuals
right,
in these type of situations in any capacity.
but I think they're looking more at, like the layout and that kind of thing, or what escape, kind of, and you need to plan that anyway if you're going to homes or whatever, so you should have some of those basic,
And this did not appear to be a situation where it was like, and I think like what you're kind of talking about, Commissioner Vetch, where it kind of escalates beyond. This was kind of went from a simmer to a boil very quickly. So, yeah, I think, our staff did everything correctly. It was just a really bad situation. Then on another note, I just wanted, I think I mentioned it at another meeting, but, and actually John Holler said, well, thank goodness, because I never know what your name really is. I am going to just plain Jamie Goodrum. So the notes, I think, reflect today just Jamie Goodrum. It's been my legal name since 2012. I kept the husband. I just lost his name many years ago. I didn't want to have the county pay more money for letterhead out at the HSC, and now that we're getting a new address anyhow for all of our letterhead, I figured I might as well just go with my actual last name, so now when I sign contracts, it's actually a legal signature. So in case you're wondering, I'll be married 40 years in April, so like I said, kept him, just lost his name a number of years ago, and that's all I have.
She just got tired of adding extra letters on her signature to
That's
make it
right.
legal.
Well, everyone like, do I make it a hyphen? Is it a double last name? Is it one or the other? Then I think just last week, Michelle had a PowerPoint presentation that said Jamie Schwartz, and I actually haven't even just said.
And
And
Jill.
Jill. I'm like, Jamie Schwartz, I haven't even seen that for a lot of years.
Because I do want to hear more about this.
Yeah.
And like I said, I'm not trying to put like a hole in it. I guess, but when you do it, I wanted like, what is the average length of stays when you're working with Pat O'Malley over there? If you can get kind of what are the stay lengths that we're at right now? And what program that we have that maybe still makes sense to what maybe can't be just in the short term? And see if we could, if it still makes sense to maybe, because the program I think has a lot
I
of
just had
validity
that
to it. I
handed
just
to
wanna make
me
sure
on
the timing
Thursday
right.
this last week, so it's really new news that this, and actually, they did the calculation for the 4 counties. I think every time I see it calculated out, it's a little bit different, but this time they took into account population, number of jail beds used, homeless nights in the county and things like that. So there potentially are, and I think like what Jill is working on with the sheriff's office right now is more downstream where she's working with them upon release, how they're going to handle it. It might be nice to use these funds more upfront, more upriver, like, with some of these populations. So, potentially to.
Can I also just add that Caitlin, who was up as part of our Employee of the Month, she's actually our adult outreach worker, and part of our mission with her is to be working with them on the front end, on the more proactive side of things before folks are incarcerated. So we're trying to get it from both sides, through Caitlin and through Jill, but of course, we're not going to go around.
Yep. So, and if this is likely, I'm guessing not supplantable funds either, so we'll just have to take a look at it
All
as we
right.
go forward. That's all I have.
Mr. Chair?
Yes.
And just a consequence of getting stuff last minute, I just got to read this over for a second, but can you advise on the North Star Regional Riverwood campus, if that's a nonprofit place?
I don't know their status for the business. They have multiple facilities across the state.
And then second thing, is you probably all know that we're going through the proposal for Teen Challenge in Rockford Township. How does this compare, if you know, to the setup there? Because it looks like a lot of similar, it's males, it's
I
lodging.
think that's a
it's-
younger population.
Well, those are adults there.
No, it's gonna be adults in our,
Oh, okay.
in that area.
This one's pretty much adult too.
That one I know is focused on adults only, my
This is
understanding.
adult men's, this North Star. I don't know anything about.
And they were in the planning stages as far as Commissioner Vetch mentioned the business model. I mean, they looked at it, it was before COVID, I think they started looking at this facility. You're looking like you're not quite sure, Diane.
I don't know anything.
Okay.
I don't know about the facility.
But it seemed like we were working with them for quite a while, like on group residential housing, unless it's a different, occupier of the same location. I think this location's been very feasible because it's kind of right on that between Sherburne County and Wright County, and, the area that it could pull in, is I think fairly advantageous. So I think they were doing some market studies, and it was looking like it was pretty favorable. And we're always looking for residential centers, so.
Yeah,
Looks
I'm
like
just
it's both
curious whether
residential
they
and
went through
outpatient.
the not in my backyard situation with all the neighbors.
Yeah, I didn't hear any rumblings in that area. I
I'm getting
think,
plenty of that.
right, well, actually, Mark would probably know. I think Mark had actually gone to one of their board meetings.
The city planning meetings, and things Mark was involved in and
Yeah.
had gone to that. This process has been about a year and a half, 2 years in the making with all of the renovations that they had to do to get the facility up to speed. So it was a hotel, and they had to do everything from fill in the swimming pool to get
Oh,
that
yeah.
removed and situated to revamp the entire multiple buildings.
Like 20 years ago, my understanding is this is where the NFL would have their players stay when they were playing
Well,
here in Minnesota.
That was a stretch. It actually was one time. And
Oh,
it
one
was the
time.
90
I'd like to perpetuate urban
It was
myths.
the 92 Super Bowl and one of the teams stayed there when they played at the Metrodome, for what it's worth.
Like I said, so that's only 20 years ago. I'm just like keeping things going after many, many years.
Well,
So.
that's helpful. That's why we didn't hear much about this, is because it went through the planning and zoning in the city of Otsego.
Yeah, Mark was involved with it, and we gave him a call early on in the process, and he was very aware of it.
Yeah.
We do, like when we do have things like this coming up, like to alert the commissioner that's in the crux of things, so.
Yeah, I know they had a lot of weddings and stuff there. They put up a lot of tents and stuff, because I've got some friends that, that's where their wedding was, so.
Yeah, they won Business of the Year one year when they first started out, I think.
And Timothy's, as far as the restaurant part, it was good for a while, and then it went, it was horrible.
We could add a food critic section to our HHS board meeting.
Well, if there's no other business here, we will end the HHS meeting here at 2:52.